Question 1. A nurse is assessing a client with irregular menstrual cycles and heavy bleeding for the past 3 months. Which nursing action demonstrates the first step of clinical judgment in gynecologic care? A. Review the client's hemoglobin and hematocrit levels. B. Obtain a detailed menstrual and reproductive history. C. Educate the client about hormonal treatment options. D. Prepare the client for a pelvic ultrasound. Answer. B. Obtain a detailed menstrual and reproductive history. Rationale. Clinical judgment begins with comprehensive assessment. Gathering a detailed menstrual and reproductive history helps identify potential causes of abnormal uterine bleeding. Reviewing labs and diagnostic tests are important, but follow assessment. Education and preparation for procedures occur after sufficient data collection. Question 2. A client presents with lower abdominal pain and abnormal vaginal discharge. Which finding should the nurse prioritize when determining the risk for pelvic inflammatory disease, PID? A. History of recent antibiotic use. B. Elevated body temperature and cervical motion tenderness. C. Use of oral contraceptives. D. Family history of gynecologic cancer. Answer. B. Elevated body temperature and cervical motion tenderness. Rationale. Fever and cervical motion tenderness are classic indicators of PID and signal an acute infection requiring prompt intervention. Antibiotic history and contraceptive use are less critical. Family history of cancer does not relate to acute infectious risk. Question 3. A nurse is caring for a client with suspected ectopic pregnancy. Which action reflects appropriate prioritization in clinical judgment? A. Provide emotional support regarding future fertility. B. Obtain informed consent for surgical intervention. C. Assess for signs of internal bleeding and hemodynamic instability. D. Educate the client about methotrexate therapy. Answer. C. Assess for signs of internal bleeding and hemodynamic instability. Rationale. Ectopic pregnancy can rapidly become life-threatening due to hemorrhage. Immediate assessment for instability is the highest priority. Emotional support, consent, and education are important, but secondary to patient safety. Question 4. A client with uterine fibroids reports increasing pelvic pressure and urinary frequency. Which nursing decision best supports evidence-based practice? A. Reassure the client that symptoms are expected. B. Recommend increased fluid intake only. C. Collaborate with the provider to evaluate treatment options based on symptom severity. D. Delay further intervention until menopause. Answer. C. Collaborate with the provider to evaluate treatment options based on symptom severity. Rationale. Evidence-based practice emphasizes individualized care. Collaboration allows consideration of medical or surgical management based on symptom impact. Reassurance or delaying care may ignore worsening symptoms, and fluids alone do not address fibroid effects. Question 5. A nurse is caring for a client diagnosed with endometriosis. Which nursing intervention best demonstrates critical thinking in pain management? A. Encourage complete bed rest during menses. B. Administer analgesics only when pain becomes severe. C. Assess pain patterns and evaluate the effectiveness of both pharmacologic and non-pharmacologic strategies. D. Advise the client to avoid physical activity permanently. Answer. C. Assess pain patterns and evaluate the effectiveness of both pharmacologic and non-pharmacologic strategies. Rationale. Critical thinking involves ongoing assessment and evaluation of interventions. Endometriosis pain varies and requires a multimodal approach. Delaying medication, excessive rest, or activity avoidance may worsen symptoms or reduce quality of life. Question 6. A nurse encounters an ethical dilemma when a competent adult client refuses a recommended gynecologic procedure. What is the nurse's best action? A. Notify hospital administration immediately. B. Document refusal and respect the client's autonomous decision. C. Attempt to persuade the client to accept the procedure. D. Proceed with preparation for the procedure. Answer. B. Document refusal and respect the client's autonomous decision. Rationale. Respect for autonomy is a core ethical principle. A competent client has the right to refuse care. Persuasion or proceeding without consent violates ethical and legal standards. Administration may be consulted later, but is not the first action. Question 7. A client is scheduled for a pap smear. Which nursing action best promotes patient safety and effective communication? A. Perform the procedure without explanation to reduce anxiety. B. Explain the procedure and obtain informed consent before beginning. C. Ask the client to sign consent after the procedure. D. Delegate teaching to unlicensed assistive personnel. Answer. B. Explain the procedure and obtain informed consent before beginning. Rationale. Clear communication and informed consent are essential for patient safety and trust. Lack of explanation increases anxiety and violates ethical standards. Consent must be obtained beforehand, and teaching is the nurse's responsibility. Question 8. A nurse is evaluating outcomes for a client treated for a vaginal infection. Which finding best indicates effective clinical judgment during the evaluation phase? A. The client reports decreased itching and discharge. B. The nurse administered antibiotics on time. C. The provider prescribed a new medication. D. The client scheduled a follow-up appointment. Answer. A. The client reports decreased itching and discharge. Rationale. Evaluation focuses on patient outcomes. Symptom improvement indicates effective intervention. Medication administration and prescriptions reflect implementation, while follow-up scheduling does not directly measure treatment effectiveness. Question 9. A client reports postmenopausal bleeding. Which nursing action reflects appropriate risk management? A. Document the finding as normal aging. B. Recommend over-the-counter hormone therapy. C. Promptly report the finding to the healthcare provider. D. Schedule the next routine annual visit. Answer. C. Promptly report the finding to the healthcare provider. Rationale. Postmenopausal bleeding is abnormal and may indicate malignancy. Prompt reporting supports early diagnosis and risk reduction. Normalizing or delaying evaluation can result in serious harm. Question 10. A nurse collaborates with a multidisciplinary team for a client undergoing gynecologic surgery. Which action best supports effective clinical decision-making? A. Rely solely on physician orders. B. Limit communication to written documentation only. C. Share relevant assessment findings and advocate for the client's needs. D. Avoid discussing concerns during team meetings. Answer. C. Share relevant assessment findings and advocate for the client's needs. Rationale. Effective collaboration requires active communication and advocacy. Nurses contribute critical assessment data that influence decisions. Passive reliance on orders or limited communication undermines patient-centered care. Question 11. A 42-year-old client presents to the gynecology clinic reporting heavy menstrual bleeding for 4 months with passage of clots and fatigue. Which initial nursing assessment finding is most concerning? A. Report cycles lasting 7 days. B. Uses one pad every 4 hours. C. Dizziness with position changes. D. Mild lower abdominal cramping. Answer. C. Dizziness with position changes. Rationale. Orthostatic dizziness suggests possible anemia and hypovolemia from chronic blood loss, making it the most concerning finding. Longer cycles and cramping can be expected with heavy menses, and pad usage does not indicate immediate instability. Question 12. Based on the assessment findings, which nursing action should be prioritized next? A. Educate the client on iron-rich foods. B. Obtain vital signs, including orthostatic measurements. C. Prepare the client for endometrial biopsy. D. Provide reassurance about perimenopause. Answer. B. Obtain vital signs, including orthostatic measurements. Rationale. NGN prioritization emphasizes safety and physiologic stability. Orthostatic vitals help evaluate volume status and anemia. Education, reassurance, and procedures come after stabilization and data collection. Question 13. Laboratory results show hemoglobin 8.4 gram per deciliter and hematocrit 26%. Which interpretation demonstrates accurate clinical judgment? A. Values are slightly below normal and require no action. B. Findings indicate acute infection. C. Results suggest significant anemia related to blood loss. D. Results confirm uterine malignancy. Answer: C. Results suggest significant anemia related to blood loss. Rationale: hemoglobin and hematocrit are well below normal, indicating clinically significant anemia, likely due to chronic bleeding. These labs do not diagnose infection or malignancy, but signal the need for intervention. Question 14. The provider orders a transvaginal ultrasound. Which nursing action best supports patient-centered care? A. Explain the purpose and steps of the procedure. B. Proceed quickly to reduce clinic delays. C. Delegate teaching to assistive personnel. D. Ask the client to sign consent without discussion. Answer: A. Explain the purpose and steps of the procedure. Rationale: NGN emphasizes communication and informed consent. Clear explanation reduces anxiety and promotes cooperation. Delegation and rushing compromise ethical and professional standards. Question 15. Ultrasound results reveal uterine fibroids. Which nursing response best reflects evidence-based practice? A. Inform the client surgery is always required. B. Recommend no treatment until menopause. C. Collaborate with the provider to discuss medical and surgical options. D. Advise immediate hysterectomy. Answer: C. Collaborate with the provider to discuss medical and surgical options. Rationale: evidence-based care considers symptom severity, fertility desires, and patient preferences. Collaboration supports individualized treatment. Surgery is not always required, and delaying care may worsen symptoms. Question 16. The client asks if she can refuse treatment. Which nursing response best demonstrates ethical clinical judgment? A. You must follow the provider's recommendation. B. Refusing care could cause serious harm. C. You have the right to make informed decisions about your care. D. Treatment refusal must be approved by administration. Answer: C. You have the right to make informed decisions about your care. Rationale: respect for autonomy is a core ethical principle. Competent clients have the right to accept or refuse treatment after receiving adequate information. Coercion violates ethical nursing practice. Question 17. The client begins iron therapy. Which finding best indicates effective nursing evaluation? A. Iron pills are taken daily. B. Hemoglobin levels gradually improve. C. The prescription is filled. D. Follow-up is scheduled. Answer: B. Hemoglobin levels gradually improve. Rationale: evaluation focuses on outcomes, not tasks. Improved lab values demonstrate effective treatment. Taking medication or scheduling follow-up reflects implementation, not evaluation. Question 18. The client reports constipation from iron supplements. Which nursing intervention reflects clinical judgment and safety? A. Discontinue iron therapy. B. Recommend increased fluids, fiber, and activity. C. Advise the client to reduce the dose independently. D. Ignore the symptom as expected. Answer: B. Recommend increased fluids, fiber, and activity. Rationale: anticipating and managing side effects supports adherence and safety. Discontinuing or altering dosage without guidance is unsafe, and ignoring symptoms undermines patient-centered care. Question 19. During follow-up, the client reports continued heavy bleeding despite treatment. What is the nurse's best next action? A. Document findings and take no action. B. Encourage the client to wait another 6 months. C. Notify the provider of treatment failure. D. Advise over-the-counter hormonal therapy. Answer: C. Notify the provider of treatment failure. Rationale: NGN emphasizes reassessment and escalation when outcomes are unmet. Persistent bleeding requires further evaluation. Delaying care increases risk of complications. Question 20. Which outcome best demonstrates successful clinical judgment throughout this unfolding case? A. All provider orders were followed. B. The client verbalizes understanding and participates in care decisions. C. Diagnostic tests were completed on time. D. Documentation was thorough. Answer: B. The client verbalizes understanding and participates in care decisions. Rationale: successful clinical judgment integrates safety, communication, ethics, and patient engagement. Active participation reflects effective assessment, education, and collaboration, not just task completion. Question 21. A 29-year-old client presents to the emergency department with sharp lower abdominal pain, light vaginal spotting, and nausea. Her last menstrual period was 7 weeks ago. Which assessment finding requires immediate attention? A. Reports pain rated 6 out of 10. B. History of smoking. C. Shoulder pain and dizziness. D. Mild anxiety. Answer: C. Shoulder pain and dizziness. Rationale: referred shoulder pain and dizziness suggest possible intra-abdominal bleeding and diaphragmatic irritation, indicating a potentially life-threatening condition. Pain score, smoking history, and anxiety are relevant, but not immediately life-threatening. Question 22. The nurse suspects an ectopic pregnancy. Which action should the nurse prioritize? A. Obtain a urine pregnancy test. B. Establish IV access and assess vital signs. C. Prepare the client for discharge teaching. D. Administer prescribed antiemetics. Answer: B. Establish IV access and assess vital signs. Rationale: physiologic stability and rapid assessment are the priority when ectopic pregnancy is suspected. IV access supports emergency intervention. Diagnostic confirmation and symptom management follow stabilization. Question 23. Vital signs show blood pressure 90/56 millimeters of mercury and heart rate 118 per minute. Which interpretation best reflects clinical judgment? A. Findings indicate anxiety. B. Results are expected in early pregnancy. C. Signs suggest hypovolemic shock. D. Data confirm infection. Answer: C. Signs suggest hypovolemic shock. Rationale: hypotension and tachycardia are classic indicators of volume loss and shock, requiring immediate intervention. Anxiety or normal pregnancy changes do not explain these findings. Question 24. The provider orders immediate transvaginal ultrasound and serum beta-HCG. Which nursing action best supports patient safety? A. Delay tests until pain subsides. B. Ensure the client remains NPO. C. Encourage ambulation to reduce discomfort. D. Provide discharge instructions. Answer: B. Ensure the client remains NPO. Rationale: keeping the client NPO prepares for potential surgical intervention. Delaying diagnostics or encouraging ambulation increases risk. Discharge is unsafe given instability. Question 25. The ultrasound confirms a ruptured ectopic pregnancy. Which nursing action reflects correct prioritization? A. Provide detailed fertility counseling. B. Obtain written informed consent for surgery. C. Activate emergency surgical protocols. D. Administer oral analgesics. Answer: C. Activate emergency surgical protocols. Rationale: a ruptured ectopic pregnancy is a surgical emergency. Rapid intervention is required to prevent death. Education and consent occur as feasible, but do not delay life-saving care. Question 26. Post-operatively, which assessment finding is most concerning? A. Incisional pain rated 5 out of 10. B. Urine output 20 milliliters per hour. C. Mild abdominal tenderness. D. Drowsiness after anesthesia. Answer: B. Urine output 20 milliliters per hour. Rationale: low urine output indicates inadequate perfusion or ongoing volume deficit. Pain, tenderness, and drowsiness are expected post-operative findings. Question 27. The client expresses guilt and grief over pregnancy loss. Which nursing response demonstrates therapeutic communication? A. You can try again soon. B. Everything happens for a reason. C. This loss can be very difficult. I'm here to listen. D. Focus on your physical recovery first. Answer. C. This loss can be very difficult. I'm here to listen. Rationale. Acknowledging emotions and offering presence supports psychological healing. Minimizing or redirecting feelings is non-therapeutic. Question 28. The client asks about future fertility. Which response reflects accurate clinical judgment? A. You will not be able to conceive again. B. Future fertility depends on the extent of tubal damage. C. Pregnancy is unsafe after this condition. D. Fertility outcomes cannot be discussed. Answer. B. Future fertility depends on the extent of tubal damage. Rationale. Fertility outcomes vary and should be discussed realistically without absolutes. Honest, individualized education supports informed decision-making. Question 29. Which discharge teaching is the highest priority for this client? A. Resume exercise immediately. B. Avoid sexual activity until cleared by the provider. C. Expect irregular bleeding for several months. D. Delay follow-up appointments. Answer. B. Avoid sexual activity until cleared by the provider. Rationale. Preventing infection and supporting healing are priorities after surgery. Activity progression and bleeding patterns are important but secondary. Follow-up is essential and should not be delayed. Question 30. Which outcome best indicates effective clinical judgment across the entire episode of care? A. All procedures were completed quickly. B. The nurse followed all provider orders. C. The client remained hemodynamically stable and engaged in recovery planning. D. Documentation was completed accurately. Answer. C. The client remained hemodynamically stable and engaged in recovery planning. Rationale. Optimal clinical judgment integrates safety, stabilization, communication, emotional support, and patient involvement, not just task completion. Question 31. A 35-year-old client presents 3 days after a dilation and curettage with pelvic pain, foul-smelling vaginal discharge, and fever. Which findings should the nurse recognize as indicators of possible infection? Select all that apply. A. Temperature 38.6 degrees Celsius, 101.5 degrees Fahrenheit. B. WBC count 17,000 per cubic millimeter. C. Bradycardia at 54 per minute. D. Uterine tenderness on palpation. Answer. A. Temperature 38.6 degrees Celsius, 101.5 degrees Fahrenheit. B. WBC count 17,000 per cubic millimeter. D. Uterine tenderness on palpation. Rationale. Fever, leukocytosis, and uterine tenderness are classic indicators of post-procedure pelvic infection. Bradycardia is not expected and does not support an infectious process. Question 32. The nurse is prioritizing care for this client. Which actions should be taken immediately? Select all that apply. A. Obtain blood cultures as ordered. B. Initiate prescribed broad-spectrum IV antibiotics. C. Encourage oral fluids only. D. Monitor vital signs closely. Answer. A. Obtain blood cultures as ordered. B. Initiate prescribed broad-spectrum IV antibiotics. D. Monitor vital signs closely. Rationale. Early identification and treatment of infection are critical. Cultures should be obtained before antibiotics when possible. Antibiotics address the source, and close monitoring detects deterioration. Oral fluids alone are insufficient. Question 33. The client becomes hypotensive with tachycardia. Which findings support progression to sepsis? Select all that apply. A. Blood pressure 86 over 50 millimeters of mercury. B. Heart rate 124 per minute. C. Oxygen saturation 99%. D. Altered mental status. Answer. A. Blood pressure 86 over 50 millimeters of mercury. B. Heart rate 124 per minute. D. Altered mental status. Rationale. Hypotension, tachycardia, and altered mentation indicate systemic involvement and possible sepsis. Normal oxygen saturation alone does not exclude sepsis. Question 34. Which nursing actions are appropriate to reduce mortality risk at this stage? Select all that apply. A. Administer IV fluid bolus as ordered. B. Apply supplemental oxygen. C. Delay interventions until culture results return. D. Prepare for possible ICU transfer. Answer. A. Administer IV fluid bolus as ordered. B. Apply supplemental oxygen. D. Prepare for possible ICU transfer. Rationale. Rapid hemodynamic support and escalation of care are essential in sepsis management. Delaying care until results return significantly increases mortality risk. Question 35. The nurse evaluates the effectiveness of interventions. Which findings indicate improvement? Select all that apply. A. Mean arterial pressure above 65 millimeters of mercury. B. Decreasing lactate levels. C. Persistent oliguria. D. Improved level of consciousness. Answer. A. Mean arterial pressure above 65 millimeters of mercury. B. Decreasing lactate levels. D. Improved level of consciousness. Rationale. Adequate perfusion, improving lactate, and improved mentation indicate response to treatment. Oliguria suggests ongoing hypoperfusion. Question 36. The client asks why the infection became severe so quickly. Which explanations should the nurse include? Select all that apply. A. Pelvic procedures increase infection risk. B. Delayed treatment allows systemic spread. C. All post-procedure infections progress to sepsis. D. Early symptoms may be subtle. Answer. A. Pelvic procedures increase infection risk. B. Delayed treatment allows systemic spread. D. Early symptoms may be subtle. Rationale. Invasive procedures, subtle early symptoms, and delayed intervention increase risk. Not all infections progress to sepsis. Question 37. The nurse is completing a matrix-style risk assessment. Which factors increase this client's risk for complications? A. Recent uterine instrumentation. B. Elevated white blood cell count. C. Early antibiotic initiation. D. Hypotension. Answer. A. Recent uterine instrumentation. B. Elevated white blood cell count. D. Hypotension. Rationale. Procedural exposure, leukocytosis, and hemodynamic instability increase complication risk. Early antibiotics reduce risk. Question 38. Which nursing actions demonstrate effective interprofessional collaboration? Select all that apply. A. Communicating changes in vital signs promptly. B. Independently adjusting antibiotic dosages. C. Coordinating care with critical care services. D. Documenting responses to treatment. Answer. A. Communicating changes in vital signs promptly. C. Coordinating care with critical care services. D. Documenting responses to treatment. Rationale. Collaboration relies on timely communication, coordination, and documentation. Independent medication changes exceed nursing scope. Question 39. Prior to discharge, which teaching points are essential to prevent recurrence? Select all that apply. A. Complete the full course of antibiotics. B. Report fever or foul discharge immediately. C. Resume sexual activity within 48 hours. D. Attend scheduled follow-up appointments. Answer. A. Complete the full course of antibiotics. B. Report fever or foul discharge immediately. D. Attend scheduled follow-up appointments. Rationale. Adherence, early symptom recognition, and follow-up reduce recurrence risk. Early sexual activity increases infection risk. Question 40. Which overall outcome best reflects expert-level clinical judgment in this unfolding case? A. Rapid task completion. B. Strict adherence to routines. C. Early recognition, escalation, and prevention of deterioration. D. Minimal patient interaction. Answer. C. Early recognition, escalation, and prevention of deterioration. Rationale. Expert clinical judgment integrates early cue recognition, rapid intervention, collaboration, and prevention of harm, not task-focused care. Question 41. A 24-year-old client presents with lower abdominal pain, fever, and purulent cervical discharge. Identify the correct clinical judgment pathway for this client. A. Assessment, education, evaluation. B. Risk factors, nursing actions, expected outcomes. C. Diagnosis, planning, documentation. D. Orders, implementation, discharge. Answer. B. Risk factors, nursing actions, expected outcomes. Rationale. Bowtie NGN items evaluate the nurse's ability to link contributing factors to appropriate actions and measurable outcomes. PID management requires identifying risks, e.g. STI exposure, implementing timely interventions, and evaluating physiologic response. Other sequences omit essential judgment steps. Question 42. Which findings increase this client's risk for complications? A. Multiple sexual partners. B. Fever 39 degrees C, 102.2 degrees Fahrenheit. C. Use of barrier contraception. D. Elevated C-reactive protein. Answer. A. Multiple sexual partners. B. Fever 39 degrees Celsius, 102.2 degrees Fahrenheit. D. Elevated C-reactive protein. Rationale. Multiple partners increase STI risk, fever signals systemic infection, and elevated inflammatory markers indicate severe disease. Barrier contraception is protective and does not increase risk. Question 43. The nurse must prioritize interventions for this client. Which action should be performed first? A. Provide pain medication. B. Initiate prescribed IV antibiotics. C. Educate on safe sexual practices. D. Obtain informed consent. Answer. B. Initiate prescribed IV antibiotics. Rationale. NGN prioritization emphasizes preventing deterioration. Early antibiotic administration is critical to prevent infertility, abscess formation, and sepsis. Pain control and education are important but secondary. Question 44. Over the next 6 hours, which trend best indicates effective treatment? A. Decreasing temperature and WBC count. B. Persistent tachycardia. C. Increasing abdominal tenderness. D. Rising C-reactive protein. Answer. A. Decreasing temperature and WBC count. Rationale. Downward trends in fever and leukocytosis reflect positive response to therapy. Worsening vitals or inflammation markers indicate treatment failure. Question 45. Which outcome best confirms successful clinical judgment in this case? A. Completion of antibiotic therapy. B. Client verbalizes understanding of PID. C. Resolution of symptoms with preserved reproductive function. D. Accurate documentation completed. Answer. C. Resolution of symptoms with preserved reproductive function. Rationale. Expert clinical judgment focuses on long-term patient safety and functional outcomes. Symptom resolution and fertility preservation reflect timely recognition, prioritization, and intervention, not just task completion. Question 46. A 33-year-old client presents with mild pelvic discomfort, light spotting, and fatigue. Vital signs are BP 108 over 70 millimeters of mercury, HR 96 per minute, RR 18 per minute, T 37.3 degrees Celsius 99.1 degrees Fahrenheit. Which assessment finding is the most concerning subtle cue? A. Heart rate of 96 per minute. B. Light vaginal spotting. C. Reports feeling more tired than usual. D. Normal temperature. Answer. C. Reports feeling more tired than usual. Rationale. Unexplained fatigue can indicate early anemia or occult blood loss. The vitals appear acceptable, making this an easy-to-miss cue. Mild tachycardia and spotting are common and less predictive without context. Question 47. The nurse reviews labs. Hemoglobin 9.6 gram per deciliter. Hematocrit 29%. Which interpretation reflects expert-level clinical judgment? A. Findings are expected with menstruation. B. Results suggest early compensated blood loss. C. Values confirm acute infection. D. Labs indicate iron overload. Answer. B. Results suggest early compensated blood loss. Rationale. The client is compensating, explaining near normal vital signs. Dismissing these labs delays intervention and increases risk of decompensation. Question 48. The provider plans outpatient management. Which nursing action best challenges unsafe clinical reasoning? A. Schedule routine follow-up in 6 months. B. Reinforce oral iron therapy. C. Recommend immediate evaluation of bleeding source. D. Provide reassurance. Answer. C. Recommend immediate evaluation of bleeding source. Rationale. Subtle anemia with ongoing symptoms requires investigation. Waiting or reassuring ignores a potentially progressive condition. This item tests the nurse's willingness to escalate care. Question 49. The client later reports sudden shoulder pain and dizziness. Which findings should the nurse recognize as red flags? Select all that apply. A. Referred shoulder pain. B. Orthostatic dizziness. C. Absence of fever. D. Recent spotting history. Answer. A. Referred shoulder pain. B. Orthostatic dizziness. D. Recent spotting history. Rationale. Referred pain and dizziness suggest internal bleeding. Absence of fever is misleading and should not provide reassurance. The spotting history ties the symptoms together. Question 50. Identify the correct linkage for this client's deterioration. A. Risk, anxiety action, reassurance outcome, stability. B. Risk, occult hemorrhage action, rapid assessment and escalation outcome, hemodynamic stability. C. Risk, infection action, antipyretics outcome, comfort. D. Risk, pain action, analgesial outcome, discharge. Answer. B. Risk, occult hemorrhage action, rapid assessment and escalation outcome, hemodynamic stability. Rationale. This bow tie traps task-focused thinking. Correct judgment links subtle cues to life-threatening risk and prioritizes escalation, not comfort measures. Question 51. Imaging confirms a ruptured ectopic pregnancy. Which earlier finding was the clearest missed warning sign? A. Normal temperature. B. Mild pelvic discomfort. C. Progressive fatigue. D. Light spotting. Answer. C. Progressive fatigue. Rationale. Fatigue reflected ongoing blood loss long before collapse. NGN items reward recognizing the earliest indicator, not the loudest symptom. Question 52. Which outcome best demonstrates expert-level prevention of patient harm in this case? A. Rapid documentation completion. B. Early recognition of subtle cues and timely escalation. C. Adherence to routine protocols. D. Efficient discharge planning. Answer. B. Early recognition of subtle cues and timely escalation. Rationale. Ultra-NGN emphasizes anticipation, not reaction. Expert nurses act before instability occurs, preventing catastrophic outcomes. Question 53. A client presents with mild pelvic pain and scant vaginal bleeding. Which findings should prompt immediate escalation of care? Select all that apply. A. Heart rate 102 per minute. B. Hemoglobin 10.1 gram per deciliter. C. Reports dizziness when standing. D. Temperature 37.1 degrees Celsius 98.8 degrees Fahrenheit. Answer. A. Heart rate 102 per minute. B. Hemoglobin 10.1 gram per deciliter. C. Reports dizziness when standing. Rationale. Most nurses choose A only and miss the pattern. Partial credit is earned for recognizing any instability cue, but full credit requires linking tachycardia, anemia, and orthostatic symptoms. Normal temperature is a distractor. Question 54. Identify the correct linkage for this client. A. Risk, anxiety action, reassurance outcome, comfort. B. Risk, early hemorrhage action, focused assessment and escalation outcome, hemodynamic stability. C. Risk, infection action, antipyretics outcome, afebrile. D. Risk, pain action, analgesics outcome, discharge. Answer. B. Risk, early hemorrhage action, focused assessment and escalation outcome, hemodynamic stability. Rationale. Most nurses choose D because pain is visible. Bowtie scoring rewards recognizing the hidden risk, not the obvious symptom. Comfort-based actions score 0 credit. Question 55. Which data increase concern for internal bleeding? A. Light vaginal spotting. B. Rising heart rate trend. C. Fatigue over several days. D. Normal blood pressure. Answer: B. Rising heart rate trend. C. Fatigue over several days. Rationale: many choose A, but spotting alone is common. Partial credit for selecting B or C. Full credit requires recognizing trend-based tachycardia plus fatigue as compensatory responses. Normal BP is a classic false reassurance trap. Question 56. Which nursing action should occur first? A. Administer prescribed analgesics. B. Reassess pain level. C. Perform focused hemodynamic assessment. D. Provide emotional reassurance. Answer: C. Perform focused hemodynamic assessment. Rationale: most nurses choose A. NGN scoring gives no credit for symptom management when physiologic instability has not been ruled out. Assessment before intervention earns full credit. Question 57. Which findings indicate the client is compensating for blood loss? Select all that apply. A. Mild tachycardia. B. Normal blood pressure. C. Pallor. D. Absence of fever. Answer: A. Mild tachycardia. B. Normal blood pressure. C. Pallor. Rationale: this is a classic NGN trap. Many exclude B, but normal BP during blood loss is a compensation sign, not reassurance. Full credit requires selecting A plus B plus C. Question 58. Over 4 hours, which trend is most concerning? A. Pain score decreases from 6 to 4. B. Heart rate increases from 92 to 108 per minute. C. Temperature remains stable. D. Client reports feeling calmer. Answer: B. Heart rate increases from 92 to 108 per minute. Rationale: nurses often choose A. NGN scoring prioritizes trend deterioration over symptom improvement. Pain relief does not equal stability. Question 59. The provider suggests outpatient follow-up. Which nurse response reflects expert-level judgment? A. Agree and arrange follow-up. B. Document provider decision. C. Question the plan based on assessment findings. D. Provide discharge instructions. Answer: C. Question the plan based on assessment findings. Rationale: most nurses choose B to stay safe. NGN rewards advocacy and escalation when data conflict with the plan of care. Passive agreement scores low or 0 credit. Question 60. Which outcome best reflects successful prevention of harm? A. Client reports reduced pain. B. Diagnostic tests completed. C. Early escalation prevented hemodynamic collapse. D. Documentation is complete. Answer: C. Early escalation prevented hemodynamic collapse. Rationale: partial credit may be awarded for A or B, but full credit requires prevention of deterioration, which is the core goal of clinical judgment. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.